As one of the fastest growing neurological disorders in the world, Parkinson's disease is no joke. 10 million people are living with it globally, and motor and non motor symptoms gradually chip away at daily life. The standard treatment, dopaminergic medicine like levodopa, absolutely helps, but it also introduces problems over time motor fluctuations, dyskinesias, and the fact that medicine never fully restores functions. So patients and caregivers are looking for more. Specifically, therapies that support movement, balance, and day to day independence. And that's where non pharmacological therapies come in. As Parkinson's progresses, medications become less predictable. People begin experiencing on and off cycles, gait freezing, and overall reduced stability. But although non pharmacological options are expanding fast, they're rarely compared side by side. Clinically, this is a problem. How do we know which option helps which aspect of PD? And this is where my project comes in. I focused on three movement based therapies that represent completely different approaches: Tai Chi, which is mindful, slow, and balance focused movement; Yoga, which focuses on flexibility, posture, and mind body awareness; and LSVT Big, amplitude based rehabilitation for large, purposeful movements. Now, they're each studied individually, but rarely in direct comparison. So, my goal was to understand how each one influences motor, functional, and non motor outcomes, and whether they might actually complement each other. So, to answer this, I conducted a systematic review, following, of course, PRISMA 2020 guidelines. I screened 214 studies, reviewed 54 full text, and ultimately included 12 high quality trials based on the Pedro scale criteria as well for bias. I compared outcomes using standard clinical metrics like UPDRS-3, Berg Balance Scale, Timed Up and Go tests, and PDQ-39 for, of course, quality of life. A therapy that you might not have heard of, LSVT Big, is basically Parkinson's therapy turned up to max volume because it trains people to move bigger. Because in Parkinson's disease, movements slowly shrink without the person even realizing it. Across our studies, we saw that LSVT Big consistently shows the strongest improvements in motor function, especially in UPTRS-3. Patients take longer steps, walk faster, and move more purposefully. Even everyday tasks like standing up, turning, or reaching become smoother. So LSVT Big fits in as the power boost therapy of sorts. It gets people moving with amplitude and confidence, which sets the stage for other therapies. Now, Tai Chi is the opposite vibe: slow, controlled, and flow based, but surprisingly powerful for Parkinson's. The research shows major gains in balance and stability, especially on the Berg balance scale. It reduces sway, improves posture, and even lowers fall risk, which is a huge thing for quality of life. So, Tai Chi becomes the stability and control therapy. And it focuses on that bridge between pure exercise and mind body practice. Lastly, it also complements LSVT Big by strengthening postural control and reactive balance once larger steps and movements are trained. Yoga then fills any missing gaps that the other two miss. It improves flexibility, posture, and joint mobility, which are key for stiffness and rigidity problems in Parkinson's disease. But it also brings a strong mind body benefit: lower anxiety, which is a huge non motor symptom, better mood, and reduced stress. Many studies show that it has some of the best improvements in psychological well being. So, yoga is the flexibility and calm therapy, helping patients feel more open, less rigid, and mentally balanced, which supports everything else they're doing. And of course, there's that high adherence and home practice potential of yoga, which make it ideal as a long term maintenance therapy when layered onto LSVT Big and Tai Chi. So when we line these three up side to side, a clear pattern emerges. Tai Chi is best for balance. We saw the Berg balance scale scores increase and the fall risk decrease, while yoga is best for flexibility and emotional well-being. There were strong psychological benefits along with moderate mobility gains. LSVT Big is best for motor severity and amplitude. And we saw that through the UPTRS-3 scores decreasing and gait speed and stride length increasing. So these aren't really competing therapies. They're targeting different aspects of Parkinson's disease. That is the key insight of this review. So what does this mean? Together, Tai Chi, yoga, and LSVT Big create a layered, patient-centered rehabilitation model. Rather than relying solely on medication or a single type of therapy, Parkinson's disease patients may benefit most from combining LSVT Big, focusing on amplitude and gait, Tai Chi, focusing on balance and stability, and yoga, focusing on flexibility and psychological resilience. This multi-domain approach aligns with the modern standard of Parkinson's disease care, which emphasizes physical and emotional well-being as well. So not just that symptom suppression that everyone hopes for at first. However, many studies were limited by their small sample sizes, short intervention periods, and inconsistent outcome measures. Future research should always use standardized scales like the UPDRS-3 and PDQ-39 across all therapies to enable better statistical comparisons.